And when we're asking the young people to help us with this mitigation strategy by staying out of the bars, staying out of the restaurants, really trying to distance yourself, don't get the attitude, well, I'm young, I'm invulnerable. We can't do this without the young people cooperating. Please cooperate with us.
Anthony Fauci with a plea to those millennials who could be out and about despite government warnings. Even if they don't have symptoms, people in their 20s and 30s could carry the virus and spread it. Also, even though children are largely being spared, they could also be carriers. In fact, a 5-year-old in New Jersey has just tested positive, and so had the child's parents. Let's bring in our first guest. Dr. Christina Johns is a pediatric emergency physician and a senior medical advisor at PM Pediatrics. Dr. Johns, thank you so much for joining us today.
Thank you very much for having me.
Dr. Johns, I'm a parent, and in my conversations with other parents in our community, I know many of us have a lot of anxiety and a lot of questions about the coronavirus and how we can keep our kids safe and healthy. It's always a challenge to keep kids healthy, but it obviously seems particularly important now. Dr. Johns, we've been told that children don't seem to be particularly affected by the coronavirus and instead are the carriers. Is this accurate, and what does that really mean?
So the early data is really good for kids in terms of severity of illness. And in fact, while there are some children who have been affected severely, it seems as though the early data indicates that the majority really have quite a mild illness, which is a good thing, in fact. But the question is, and this is a question that we don't really know the answer to yet, but do we think that they are able to transmit the virus and be carriers of coronavirus just like adults and everybody else? Yes, we believe that they do. So that is a tricky situation. And I can appreciate, as a parent myself, everybody's anxiety about it.
Well, when it comes to social distancing, we're all learning sort of what the boundaries are here. But when it comes to social distancing in children, can you just give us some advice about what this really means? Can they have play dates? Can we take them outside to the playground? How long does this kind of a virus live on something like the monkey bars and the slides? Give us a little guidance here.
So again, I think this is a tricky one where we're learning early and a little bit as we go along. Strictly speaking, social distancing means 0 on the play dates, and it means not going to the playground. And the way that I kind of like to think about it is that, gosh, especially younger kids, they do naturally what we are saying not to do, right? They touch everything and then they touch their face and mouth. And that is certainly not anything different than what happens on the playground. Kids can be even playing far apart. They are touching surfaces and then touching their mouths. And so it's really something that is best avoided for now, for sure. We have some early sense that coronavirus can live on surfaces outside, such as playground equipment. So I would really caution against that for now. And really the strict definition of social distancing is to put a halt on the play dates. I am really encouraging parents to harness technology and have virtual games of hangman and other things like that via FaceTime and other ways so that kids can still have some social contact during this tricky time.
It's great advice. Difficult to follow, but great advice. So hopefully we're keeping ourselves isolated and staying healthy. But let's assume that a parent is infected. How should they quarantine themselves with kids in the house? Is this just a situation where if one person gets it in the family, everybody will?
It is very difficult to keep household contacts away from each other. And that is, I always call it, gosh, that's a little bit of the price of doing business as a human being on the planet. And that's really hard to avoid. But there are some things that you can do. So I like to encourage people to have a sick couch or a sick chair where the person who is sick or infected, that's their spot to be, covered with a sheet or something like that where nobody else is allowed to go. And keeping that a distance of about 6 feet away as best as you possibly can from everybody else is a good thing to do. Additionally, wiping down all surfaces, and that includes things that you forget about, like remote controls and door handles and the faucets in your sink, kitchen sink and bathroom. Those are other key places. Your keys, gosh, we could make a really long list of the things that need to be wiped down with a bleach-containing cleaner. Doing that more frequently, hand washing, all of the things that we are hearing now, coughing into your elbow. Those are really important things to do.
Dr. Johns, I'd love some guidance on how parents should deal with more routine pediatric matters. Should we be skipping well visits for our children? And if our child wakes up feeling just a little bit sick, should we be bringing them into the doctor's office or skipping that entirely?
So I think that this is really an individual case where having a phone conversation with your pediatrician or your healthcare professional can really be helpful for guidance. I know that many general primary care pediatric offices now are limiting some of their elective well visits right now and really exclusively focusing on acute care visits just for this reason. And so I think that depending on the child's symptoms, well visits can certainly be postponed. For other sick visits, I think a phone call, this is where access with your medical home is really important because you can get good guidance there.
Well, you alluded to this. Now, a lot of us are getting used to teleworking, many who've never done this before. And it sounds like this is something that the medical profession is starting to do as well. I mean, at PM Pediatrics, are doctors conducting these kind of virtual visits, and are these effective?
You know, we are. In fact, our telemedicine platform called PM Pediatrics Anywhere is growing very quickly by the day. And it is something that really can be harnessed and used very well in this situation for several different things. Very simple things like pink eye, conjunctivitis. Lots of good guidance can be gotten for minor illnesses and injuries, things that can really help be a screen and can help be a guide. Gosh, is this something that I need an in-person visit for? Additionally, for people who have concerns about coronavirus and their children, it can be a really useful way to do some screening and decide what would be the best next step, if any, based on symptoms and history and exposure. And so really, it's a really very smart use of technology at this time, and I think we're going to see a lot more of it.
Dr. Johns, we've been hearing reports about shortages of medical supplies for doctors and hospitals. Is this something that you're worried about? Is this something you think will be an ongoing problem?
You bet I'm worried about it, because I think if we don't have enough of the proper personal protective equipment, such as masks and eye shields and gowns for our healthcare teams to care for others, then more of our healthcare workforce is going to get sick, and then we're not going to be able to take care of people. And that is, of course, very, very concerning for me. So I really caution everybody out there against hoarding or buying lots and lots of masks. We need all of these supplies for our healthcare teams. It's critically important right now. We need to think about this as a marathon and not a sprint. And so we've got to really conserve and plan for what's ahead.
Dr. Johns, thank you so much for taking the time to join us today. We really appreciate it.
Thank you for having me.
You know, Berit, that was a really interesting interview with that doctor. It is amazing when you hear somebody lay it out, how much we have to think about during these times.
Absolutely. And as we discussed, there is such anxiety on the part of people and really this need to know so many things about how the virus is spreading and what we can do to keep ourselves safe.
And I think, it's interesting. I think part of what has made people so upset about this, I mean, obviously you have a pandemic. People are going to be worried, especially about their children. That's obviously your first thought. But this was a problem with the slow flow of information. I think human beings deal with things better if at least they know what they're facing.
Right, and it's hard to know sort of the veracity of the information that you're getting. I mean, people are looking to Facebook for news, and they're getting some questionable information.
Which is always a problem. You never want to go to Facebook to actually get news, especially about something as important as your family's health. And people are, and it's kind of remarkable. I've actually read a series of articles about the misinformation, the cures that we're finding on Facebook that aren't cures at all, and the symptoms that aren't symptoms at all. People have to go to the right places.
Well, and I love how the medical profession here is really adapting to the nature of the crisis. As Dr. Johns was saying, conducting some of these more routine visits virtually, and they're facing the same issues that we all are. How do you now adapt to this new challenge of teleworking? How do parents now have to take on the new role of homeschool teachers when many of us are struggling to do the same fourth grade math that our children are learning? So these are new struggles for all of us.
Is that a personal problem by any chance?
It is. We still carry the one at my house, and apparently that's not done.
Well, we're fortunate because we're at grandchildren level, so we don't have that responsibility. But it is interesting. I've talked to so many people over the past couple of days. You talk about an adjustment in life. All of a sudden, you go from worrying about your job to becoming your children's teacher.
Right, while still trying to do your job at the same time. And, you know, for many working parents, myself included, it is a challenge trying to figure out how to balance those conference calls with making sure your kids aren't killing each other at the same time.
Well, you know, you said something, you brought up tele, and it made me think about something. You know, in every crisis, something good comes out of it. And I suspect what might be the best thing to come out of this one is telemedicine. So many states have been struggling with whether or not to permit physicians to practice medicine over a screen, over a computer screen or a television screen. I think that now that is probably going to be the best way, certainly during this problem, and I think it's going to stay.
Absolutely, and for patients that may have difficulty getting into their doctor's offices, for people with compromised immune systems who sometimes that's a dangerous place for them to be, this will absolutely be a positive thing going forward, even after this pandemic is resolved.
I think that's really true, and I think it's especially true, connecting it to Dr. Johns, with children. How many times have you had to take your kids to the doctor because you're a careful mother, and if your kid's not feeling well, you're not going to take a chance. You're going to run into the doctor only to find out it's nothing. With telemedicine, we save a lot of money, a lot of time, and a lot of trouble for you.
Yeah, well, good discussion. So up next, from price gouging to people violating quarantines, there are lots of legal issues surrounding the spread of coronavirus. After the break, a former federal prosecutor joins us to discuss.